Hello, I'm Dr. David Hornbrook, the Clinical Director of Education Technology here at Keating Dental Arts in Irvine, California. This is our weekly podcast on Dental Up. We're very excited to have a repeat guest in Dr. Mark Montgomery. We spent some time together, Mark, for the last 20 years we've been great friends. We spent lots of time together, but we spent some time together talking about dentistry for our podcast back in May.
Yeah.
And we talked about sleep apnea and some of the stuff you're doing with pain control. But we're going to change topics here because, this is something that, working with these dentists at the dental lab as well as an educator and things you encounter as well, is this whole issue of dysfunctional forces and destruction in the mouth and how we deal with it, whether it be natural dentition, our patient comes in with some broken teeth and wondering why their teeth are breaking, or we decide we're going to restore, and we're not sure whether we can with long-term success.
Right.
Or we do restore and we don't have long-term success. So
Right.
Let's start by just looking at the evidence. A patient comes in, opens their mouth, and what are the things, there's some obvious and there's some things that aren't so obvious. What are the things that we see that's evidence of dysfunctional forces or dysfunction?
Yeah, I think the way that I look at things now is a little bit different than the way I did, 15 or 20 years ago. And the way I think about it now is when I see evidence of destruction or pathology on the teeth, I immediately ask myself, is this pathology related to acid, infection, or force? And it's real easy for me to look at several teeth and see what's going on and realize, okay, this is a force-related issue.
Right.
And if it's a force-related issue, then it's some sort of a dysfunctional or parafunctional problem that's creating abnormal forces on those teeth. So the evidence for that, we see that all the time, right?
Right.
It could be vertical fracture lines. It could be a cusp that comes off a tooth. It could be wear on the front teeth. It could be collapsing of the lower anteriors.
Endodontic treatment.
Endodontically treated
isolated
teeth.
tooth.
Yep. And we've seen a lot of cases where it's like a root canal after root canal after root canal, kind of hunting for where the pain
Right.
problem is, and never really evaluating the forces that are contributing to that to that dysfunction or that overload of forces. So I think about it like when I see single tooth problems, I realize that it's probably not a single tooth issue. It's a single tooth symptom of a larger force related issue. And so I look at it like, what do I need to do with the chewing system in order to get control of forces?
Okay.
And my patients have gotten much more comfortable hearing me talk about these problems, not like, oh, you have a broken tooth, it needs a crown, but like, oh, you have a broken tooth and you have a crack over here and you have receding gums over here and these front teeth are collapsing. I wonder where the abnormal forces are that are creating an imbalance in your chewing system.
Right.
And patients like the chewing system term. I don't know
Yeah.
if our audience will appreciate that, but
Yeah, you've been using that for years, and I do like it. I do like it.
so I look at it like, here's some evidence that we have a chewing system problem, and let's find out what the issues are here that we need to control so that we can design the best result.
And I think it's gotten even more important now for two primary reasons. One is our patients are living longer, and so, and then we're not going to dentures, like we used to. So as they start to live longer and what we used to say the age-related problems and this dysfunction, we're seeing broken down dentition in their later years, which would be a huge problem.
Right.
And we tend to do more aesthetic dentistry on older patients.
Right.
So if we don't address the dysfunction and the causative factors, why their teeth are short and broken and chipped and ugly, and now all of a sudden a 65-year-old would decide, oh, let's give them a beautiful new smile because they have the money and they have the health and they could live for another 20 years. If we don't address those dysfunctional issues, we're going to see failure of this beautiful dentistry. And